Now, isolated achievements such as strengthening of infectious disease surveillance have shown potential in Nigeria's healthcare development, but brain drain and inadequate risk funding are hampering the health sector's response to many health concerns. In continuation of our review of 2022, our correspondent, Enabulele Yusuf, reports about major events in the health sector in the outgoing year.
The year began with the National Association of Nigerian Nurses and Midwives going on a warning strike. The nurses claimed they were feeling overworked after calls to recruit new nurses went unheeded and after several of their colleagues traveled to take up jobs in other countries. The strike was short-lived in Lagos. Government came to the negotiating table, promising to get more hands. The phenomenon of brain drain did not abate among them and other professionals in the sector. Between 2016 and 2018, 9,000 doctors left Nigeria's shores, but the number increased in 2022.
Brain drain will always happen because people are always wanting to go outside to maybe get a better education or a better postgraduate or salary is better or whatever. But what we're doing is we have another strategic approach, which is what we call brain gain strategy. We're building a psychiatric hospital, 500-bed psychiatric hospital, and then a 1,000-bed rehabilitation center. We're developing an infectious disease research institute. Now, when you set that up, all these specialties within the system, then our colleagues abroad, doctors, nurses, are saying, hey, there's something to come back home for.
Given the declining number of cases across the country, COVID-19 restrictions were lifted by degrees, culminating in the suspension in December of PCR test requirements for all pre-departures and post-arrivals. Ironically, cases are currently spiking in China, where the pandemic began. Monkeypox had been popping up since 2017 in its most recent reappearance in Nigeria, but in a twist became a hot topic when it was reportedly transported to the UK in early May of 2022 by someone who traveled from Nigeria, and for the first time the disease spread rapidly among non-endemic countries. Other infectious diseases, including Lassa fever and cholera, were also concerns in 2022, claiming more lives than they did in the previous year.
There were disruptions to immunization, both routine and planned campaigns. The world tried to recover, to sort of say, look, essential services should return, but we know that the journey to doing that has been really hard. And now what we are seeing is we are now paying the price for the gaps that occurred there.
It was a moment of pride for Nigeria when the World Health Organization awarded the National Agency for Food and Drug Administration and Control, NAFDAC, Maturity Level 3, a certificate which grants Nigeria the capacity to use mRNA technology to manufacture vaccines, among other medical preparations. Private sector initiative in Parkinson's disease, cancer, and sickle cell anemia were also undertaken to provide much-needed diversity and availability to often neglected conditions.
With this transplant center in place in Lagos, not only will Nigerians cease to travel out to access a cure for sickle cell disease, but it will in fact be a new dawn for medical tourism into Nigeria.
In July 2022, newly appointed Minister of State for Health, Honorable Ekumankama Joseph Nkama, took over the mantle of leadership from his predecessor, Dr. Olorunimbe Mamura, who went on to become the Minister of Science and Technology. Nigerian doctors have been making their mark on the world stage, and for the first time an African, Dr. Osahon Enabulele of Nigeria, became president of the World Medical Association. The 1.179 trillion naira allocated to health in the proposed 2023 national budget may seem like a big jump from 826.9 billion awarded last year, but is a mere 5.75% of the budget. The ideal of 15% of the nation's budget being allocated to health has not been achieved yet, leaving the sector in want of funds to improve on infrastructure and research, among others. For the sector to transit from reacting to being ready for every health emergency, more must be done in research, infrastructure, recruiting manpower, and capacity building. Mary Alale Yusuf, Channels Television News.
Let's get more perspective on the subject. Joining us live from our Benin City studio in Edo State is the former president of the Nigeria Medical Association and now president of the World Medical Association, Dr. Osahon Enabulele. He joins us, as we said, from our studio in Benin City. Dr. Enabulele, thank you for joining us on the News at 10.
Thank you very much. Good evening, Nigerians.
Let's begin with your assessment of the health sector in 2022. How would you rate the Nigerian government?
Oh, yeah.
How would you rate the Nigerian government in 2022, the health sector, its performances, its achievements in 2022?
Well, I think it's still work in progress. I think it's still work in progress. There's still a lot that has to be done to transmogrify the health sector of Nigeria to meet up with what we expect, particularly looking at global, indicators. So yes, a lot more is being done to, of course, create the needed investments in the health sector, but it's still a far cry from where Nigeria should be, noting that Nigeria still remains regarded as a giant of Africa. And if some less endowed countries in Africa are already achieving universal health coverage and Nigeria is not there, that's enough indication to suggest that perhaps we need to tighten our belts, we need to work more altruistically, transparently, and engage those vital ingredients for developing a more robust and resilient health system that everyone will be proud of. That will not make Nigerians travel abroad in search of medical care. But of course, we'll have indigenous capacity, built expertise, and of course, convenient and conducive working environment with supported and motivated health workforce to deliver the best of care that you can find anywhere in the world. And it's possible in Nigeria. So there's a lot of work that still needs to be done. One of the things that amazes me at times is that if you look at some of the foundational problems we had at the very beginning, it seems to still be there. So there's a lot of work that needs to be done. That is not to say that efforts are not being made to, of course, change the narrative, but the real exercise needs to be done in terms of making very serious political commitments to moving the health sector forward.
Yeah, so we enter the year is still in a pandemic from 2020, the coronavirus pandemic that continued in its second year in 2022. The federal government has finally lifted all of the restrictions for COVID. And then there was also the challenge of monkeypox, which we have already decided is not a pandemic. How would you rate the federal government or the health ministry with its with the way it handled these diseases in 2022? And are we safe enough now to say that, we can actually live with the coronavirus and the other infectious diseases that we've had to deal with this year?
Well, thank you very much. I was recently at the Geneva headquarters of the World Health Organization to interact with the General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. And I think we generally agree that it's not good to advise citizens anywhere in the world to abandon the precautionary measures. Because again, we still have, clear cases in some countries, even now rising in some countries of the world. And that suggests that it's not yet guru. Yes, I know a lot of people are tired of wearing face masks, tired of all these safety precautions, but we must ensure that we do not lose our guards. And that is to say that there's a lot that still needs to be done to make sure that we remain alert, we remain conscious, and of course we open our communication pathways to what is happening in other countries of the world. As to what Nigeria has achieved in terms of pandemic prevention, preparedness, and recovery, there's no doubt that Nigeria, yes, showed very strong commitment towards managing the pandemic that we just had in terms of the troubling times when it started at the very beginning. Yes, there are a lot of things that there were some lapses at the very beginning, but again, as time went on, those gaps were increasingly closed. But there are still learning points that we need to take forward, especially as the world just now is looking at, firming up the pandemic threat.
Right.
The pandemic threat seeks to address some of the learning points in the COVID-19 pandemic, especially in the post-COVID pandemic era. So we need to also be part of the global conversations to ensure that those core ingredients, particularly the 14 fundamental ingredients in the pandemic threat, leverage upon to ensure that we are fundamentally well prepared for any future pandemic that may come up in Nigeria or anywhere in the world. So kudos to the Nigerian government for the way it's, of course, stepped up its game, increasingly in the face of the rising cases of COVID in Nigeria.
Right.
And of course, the WHO has since applauded the efforts of the Nigerian government in this direction. But it's not yet to hold, like I said. We still have to, of course, make sure that we do much more to build public trust. We do much more to ensure that we develop our local resource endowments
Dr. Enabulele.
in terms of local production capacity. We still have a lot to do with encouraging, motivating, and stimulating the health workforce.
Dr.
Especially in
Enabulele.
the face of the brain drain that we, of course, has become a monstrosity. I mean, a very terrible phenomenon that is not being addressed the way we ought to address it. So, in terms of the issue,
I wish we had more time, Dr. Enabulele. I wish we did. You're making really salient points tonight, and I do appreciate them. The viewers as well, I'm sure, also appreciate your thoughts on this. But thank you so much for joining us on the News at 10. We appreciate your analysis, and we hope to see you again in the new year.
I wish Nigerians a very happy new year in advance. Thank you.